Okay. Hello and welcome everyone. I'm Harry Caron, Regional Resource Director for Caron Treatment Centers serving the state of New Jersey. Thank you for joining us for the 19th installment in our webinar series, A View from the Mountain, Caron's Perspective on Addiction Treatment in the Wake of COVID-19. And today's topic, Back to School, Back to College, Helping Students Succeed Amidst the COVID-19 Pandemic. As a reminder, we will be conducting this session in webinar format. All participant microphones will be muted. During the presentation, please utilize the Q&A feature to ask any questions that you may have. Today's webinar will begin with a brief presentation, followed by a Q&A session answering the questions that you submitted during the registration process and the live questions that we receive. Therefore, we will not be offering continuing education for today's session. Today, we welcome Jonathan Salzberg, who is the Executive Director of Collegiate Services at Caron Treatment Centers. Jonathan has applied his extensive experience in business to help numerous Caron patients align their recovery with their academic and career goals. For the past several years, Jonathan has served as an entrepreneur at Caron by developing and overseeing several innovative programs. Jonathan currently serves as an advisory board member of Palm Beach State College's Human Services Business Partnership Council. He is also a member of the Independent Educational Consultants Association. Please help me welcome Jonathan Salzberg.
Thank you, Harry. Thank you so much. I am excited and grateful to be here for a topic that is so important on so many different fronts. First of all, I just want to say that I've done some of these presentations before, and I feel a little nervous today. And I'm thinking to myself, why do I feel nervous today? And I was telling my wife Jessica yesterday how excited I was about this presentation to talk about how we can support back to school students and amidst this pandemic and all that good stuff. And Jessica wanted to join and watch me in this webinar. So she's never really watched a presentation before. So I guess I'm nervous because my wife's watching me, and I hope I'm good, Jessica. So thought I'd start out that way. But thank you for everyone joining. For the last 10 years, I've had the opportunity to lead the collegiate recovery efforts at Caron Treatment Centers and to essentially develop the College Success Program, which was a way for us to be able to help patients while they're in treatment tap into their educational goals. And to really look at, not a year from now when they've completed treatment, but to look at while they're with us in the continuum of care to say, hey, what does your academic transcript look like? What does it look like going back to school? Is this school the right fit for you? Are there other schools that offer collegiate recovery programs, programs that support students in recovery that could be a better fit for you? To really look at the nitty gritty as far as how does someone develop an educational plan that really prioritizes their health and their wellness and their recovery. And I use the word recovery, but today I'm really going to be speaking in a much broader term as far as working with students and helping them prioritize their wellness and prioritize their health in this pandemic. I am here today on a number of reasons. One of the main reasons I'm here today is to speak to you about what we are at Caron are doing to address the pandemic and to support this number of displaced students that we're seeing that are either not going back to school because all schools online that need that structure and accountability, or that are dealing with the isolation and the increased isolation, depression, anxiety that I'm going to show you that we're seeing in this pandemic. We're in uncharted territory right now, so and that's why I really want this to be an interactive discussion and looking forward to your questions. Before I got on today, I met with a student. And I've been working with this student for 6 months, and the student brought up to me a really, really interesting point as he's looking to return to school is the question of, there's all this pent-up demand, that he and his friends have not been in school for the past 6 to 7 months, that, that for some of his friends that have graduated high school, they're about to go to school and sign this pledge agreement that they're going to be safe. And really, all these people, they want that traditional college experience. I mean, is it really fair? Are we setting our students up to come to a college campus with all this pent up demand to want to kind of get out there and connect? I mean, and signing these pledge agreements, are we setting these students up to come into an environment where they need a level of emotional maturity to make really healthy choices? And they've been at home for the last 6 months. And how are we going to support these students when they do act out or they do make bad choices or poor choices and are dealing with the effects of isolation? And the student was very interesting in asking, how are we prepared as a society to support this population? So I'm looking forward to speaking with you about that today. Next slide, please. So on that front, we're going to talk about 3 kind of key components to learning objectives. Really understanding, as I just said, the changing landscapes of colleges and universities. I mean, universities are under such immense pressure, and they're doing such incredible work at developing protocols and procedures for this return to school. However, we have to acknowledge the challenges that they're facing and also acknowledge what I just said, this pent-up demand, this pent-up isolation, and as we know with adolescents and emerging adults, the results of that. We're going to talk about the value of structure, accountability, and support that we're seeing. I'm currently working, and we currently work with a number of students that are in our continuum that are going to school while in treatment or while in a level of care. What we're doing and what we've seen to be very effective and how we're looking to extrapolate that into our new program. And really, again, I'm going to follow up on that is the effectiveness of students attending school while in a therapeutic environment. Next slide, please. So my specialty and my passion has been collegiate recovery for the past 10 years, and seeing that students are able to access recovery, both access recovery and their higher educational needs. We can see the statistics, only 10% have received treatment in 2016. 21 million Americans had a substance use disorder and needed treatment. Only 10% of those received treatment. 20% of the young adult population between 18 and 21 meet the criteria for substance use disorder. More than 2 in 5 young adults with mental illness disorder are treated, or I'm sorry, more than 2 in 5 went untreated, excuse me. Nearly 9 in 10 did not get treatment. And then if you go to the next slide, please. We're seeing right now increasing rates of depression, increasing rates of anxiety. One could argue that with the isolation and with that lack of social connection, how that could be leading to it and correlated to it. I know that what we see with a lot of our students in recovery, the importance of social community and social connection and being connected with other people in recovery, and how that's a challenge now in this environment. We can go to the next slide, please. Again, the impact that COVID-19 has had on us and our students. Overwhelming majority of college students are experiencing increased stress and anxiety while in this spring semester not being on a college campus, being perhaps at their parents' house or wherever, but being really isolated, as we all have been, and quarantined. These are the students that are about to return to a campus this fall, perhaps. So what does this mean for our students in their transition, if you may? Next slide, please. So I know I said something I said something on purpose, which is, how are our students going to deal with this transition this fall? And we as a society allowing these students to return to campus, is that really in their best interest? And Michael Young, the president of Texas A&M, I have this slide say, wow, wow, wow. In the Wall Street Journal had this article a few weeks back. He said that it was easier, he worked on the unification of East and West Germany for the State Department 3 decades ago. And I don't mean to read from the slide, but I think it's very, very important that we look at this slide, is that he said it was easier to figure out the unification of West and East Germany than figure out how to bring back 65,000 students to the campus Can you imagine? Easier to unify two countries than to figure out this how to bring these students back to a college campus in an effective and safe manner. So please, to the next slide. If you go to the next slide, please. On that note, what we're seeing is this is a fluid situation. We're seeing college and universities change decisions, pivot, understandably, because as we're seeing, this pandemic hasn't really eased up. In fact, it's increased. So if you look at the statistics and you see on July 1st, 63% of universities stated that they were going to be in person. Only 17% said that they were going to be hybrid, and the remaining 20%, well, 9 was online and 11 were undecided. If you fast forward this number to late July, you'll see, the next slide, please, that number dropped to 53% of colleges say that they're going to be in person, and 32% are hybrid. So you can see the hybrid number of students, colleges are increasing. I think it's really, really important to understand what hybrid means, right? What hybrid can mean is that the college is open, but all 5 classes, for instance, I have a student right now that's going to University of Texas at Austin, and we'll get to a slide about that student as a case, a good vignette is, all 5 classes are online. However, one of the classes allow for the student to be able to drop in during the week. So there is like an in-person component. So really it's hybrid, but it's mostly online. So again, students are returning to college campus with, historically, college has a lack of structure anyway. If you think about one of the things that we prepare our adolescents, emerging adults, is to really replicate structure and build their own structure to be self-sufficient when they go to college. And that, college has your classes, your 15 credit hours a week and so, and you have to build your study schedule. And, one of the things that I always loved was a rule of thumb of study 3 hours to every 1 hour of class time. So how are you basing your schedule through the week? But at least we knew that there was that accountability check-in where we knew that you had that class experience. You'd be in a classroom, there'd be other students there, and you'd have that accountability somewhat, even if the lecture was pretty large and you could get away with being very quiet. So college, even a less structured environment, is going to be now even less structured with online platforms. So how are we going to deal with that, and how are we going to support these students so they don't get lost? That's one of the big pieces. I do see that opportunities to really see how our students are doing. One of the things that we do is see how they're showing up in class, and not having that class experience can be a challenge. So please, for our next slide. So we have all these students that are, understand the risks to all these students that are coming back to school, right? That are actually, the one student that I talked about as an example, I was on the phone with her 2 weeks ago, and she said, Jonathan, I spent the summer and the spring semester being at home taking online classes and just doing them from my bedroom and being isolated and quarantined. What's the difference between me doing that now and going back to University of Texas, Austin, where all 5 of my classes are online? And, it was a good question. What's the difference? And we talked about it. And really the reason why this person's going back to UT Austin is because of the social connection, the community, which I get, right? To be with your friends and with your fellow students, and hopefully to honor social distancing and all these different things. But if you think about it, going from one environment where you're at your parents' house and there's structure and there's some accountability, going to now to be on a college campus where there's no accountability, how are we dealing with that, and what are we proposing for that? So we can go to the next slide. So you have this pent-up demand. You have these students that are in recovery. You have students that are dealing with mental health and are dealing with depression, anxiety as a situational, perhaps they've been dealing with these underlying issues prior to this COVID-19 pandemic. And then, so my niece is going to Syracuse University. I'm so excited. She just graduated. She's going to Syracuse University. She's probably embarrassed, talking about her, and Syracuse has been very thorough in all the work that they're doing as far as their protocols and their procedures. And as most universities that are opening up their campuses, I believe all, they're having use the Stay Safe Pledge, which, long story short, is signing a pledge, honoring social distancing, taking responsibility for being where you're supposed to be, not necessarily leaving campus or going to a local bar or to which you shouldn't be going under the age of 21, but going out off campus to a party, like all these different things that you're really honoring. And quite frankly, if you dishonor this pledge, there will be significant judicial issues. So I want to repeat this, that for our families that are on this webinar, as well as private practice clinicians, as well as colleagues and staff, it's really important to understand that this Stay Safe Pledge that these universities are having students sign are really, really enforceable. And what I mean by that is that if you don't follow these and you act out as a student, there will be judicial consequences. And that's where I bring up this conversation that I want to talk about today is our 18-year-old students who, are developing as a level of emotional maturity now, coming to a college campus with this isolation that they've experienced, and we've all experienced, do they have the emotional maturity to make good choices and to really honor these pledges, and to know that if they don't, that could affect the rest of their lives from a transcript standpoint, So the question I bring up to you is the student that leaves campus and goes to a party, God forbid, gets COVID-19, goes to a classroom, spreads it, God forbid, God forbid, God forbid. Are they ready to deal with those consequences? Because it's going to be the stakes are much higher than they've ever been. And how do we teach our students and our patients and our clients and our children that their decisions and choices could have incredible consequences? So the dilemma, if you may go to the next slide. Sorry, Caitlin's helping me with a slideshow here. So the dilemma. As a parent, a new parent, we have a 1-year-old. But again, I said I can relate with if you're a parent on the call and your child is going to school. Will my son or daughter be safe on a college campus? Decisions that you have to make as you're approaching the next week or two and schools are going back. Do I support my son or daughter being back on a college campus? Mom, Dad, I'll never talk to you again if you don't send me back to school. I'm never going to talk to you again. I'm going back to college. I want to go back there. I know that my classes are all online. How do you as a parent deal with that when you're hearing your child say that? And you're also scared. What happens if they get sick? God forbid. What happens if they violate the safety pledge? What does that mean for the rest of their lives? What does that mean from a job standpoint? What does that mean from, I'm paying for college. What does that mean if they're going to be able to stay at the college? What are their policies and procedures regarding if my daughter or son violates it? Well, I don't even know if they violate it. This third slide is what I said earlier, which is hearing that your child wants a traditional college experience. And I hear this so many times in my line of work, is that, Jonathan, how am I supposed to have a traditional college experience if I can't drink, or if I can't go out, and if I can't do these different things? And typically what I try to do with these students that are in recovery or trying to enter recovery or learning that they have to deal with life with on more healthier coping mechanisms is talking about other people that are on a college campus that are staying sober and making good choices, and the importance of developing new social coping mechanisms. So how are you as a parent, or how is you as a clinician dealing with these students that are about to go to school and want this traditional college experience, and they are not even in recovery, or they may not have a substance use issue, but they may have some underlying clinical issues, and they want, and they think they deserve it. How do we support them with making healthier choices and challenging that notion and saying, hey, we're all in this together right now? The fourth piece is I'm struggling with this isolation. What do I do? Do I go back to school? Do I not go back to school? What do I do? I mean, these are parents and students in the dilemma that we're seeing, and how do we help our students approach this question? So I like to try to talk about a solution. We at Caron believe that we have a mission to be able to transform lives affected by addiction, to help families and patients access recovery. pleased to report that at Caron Renaissance in the past few months, we have been granted the OCA license, which allows us to treat primary mental health, which means that someone technically can come to treatment at Caron Renaissance and be able to, and not have a substance use issue, substance use disorder. They can be presenting with anxiety, they can be presenting with depression, and presenting with life skill issues that we're trying to work through. So really what we do so well, how can we support this population of students that are affected from a mental health standpoint and emotional health standpoint during this pandemic? If we can go to the next slide, please. So one of the things that I was assigned a few months ago when this pandemic broke out was, how can we support these displaced students? How can we do more to help more college students better? And not just putting it in the box of recovery, but putting it in the box of just helping all of those who need it access care and support. And one of the things that I was listening to was this professor, Dr. Scott Galloway, who talked about, President Kennedy or Representative John F. Kennedy in 1951 talked about how our young college graduates who would find a full life in bringing technical advice and assistance to the underprivileged. He talked about how creating a Peace Corps could allow those to give back for our young to be able to see of the greater purpose in life. And Dr. Galloway said, they created the Peace Corps during that time. Why don't we create the Coronavirus Corps? Why don't we look at how our young adults, who are looking to take, who maybe would be beneficial in taking a gap year, or maybe it would be beneficial taking some time off, not feeling like they have to go back to college, but thinking about outside of themselves, how they can get back and help those that are affected in this incredible pandemic. And I'm not saying necessarily be on the front lines, but how can they give back and be part of the solution? So I thought about this, and we thought about this as an organization, and how can we alleviate this displacement of college students? How can we bridge this gap? Particularly, I'm going to mention bridge this gap of these emerging adolescents to adulthood. So 17 to 18 to 19-year-olds that are about to go back to school. And I'm not just saying it has to be 18 or 19, but what I'm saying, how do we support these students that are about to go to school and about to be faced with very, very challenging decisions? We believe that, our approach to treating young adults at Caron Renaissance and at Caron has been extremely effective, and we've helped patients and students be able to gain access to emotional maturity. And that I believe that the key to these clients and these students making good decisions on a college campus is really changing their maladaptive coping mechanisms and helping them gain the self-awareness and the emotional maturity they need to see that their decisions will impact others. If we can go to the next slide. So we thought to ourselves, how do we create a model here? How do we look at doing something at Caron that will be able to help and support a program where we're treating young adults, emerging adolescents, have to be 18-year-olds, but how can we, we look at creating or modifying our program or utilize our existing program to support this population of students that maybe going to college, being on a college campus right now, maybe it's not a great idea. Maybe it's a great idea to take some time off for a semester, do some college classes, be in a structured bubble per se, ensuring that you're safe, ensuring that you're able to still have social connection. What does that look like? How can we do that? So I thought, Dr. Galloway talked about how, gap year programs and the increased traffic, the increased online traffic to gap year programs, and the Gap Year Association talks about taking a semester or two off to really get that experiential learning after high school. And if you think about in the UK, a lot of students do that, where they take some time off from college to do some reflection and learn about themselves, explore the world, and really think about what I want to do with my life, the purpose piece. So really looked at in modifying our programming, or looking at what we're currently offering, looking at, what is a good, solid, and most effective best practice gap year model. If we can go to the next slide. If you look at the next slide, please. And if you look at it, and I really encourage you all to go to the www.gapyearassociation.org, although I'll be talking a lot about what we're doing at Caron, I encourage you to look at what other programs are out there, what other gap year programs are out there, and what they're doing. But if you look at the gap year model, you really look at their kind of their framework of looking at passion, mission, profession, vocation, looking at what can I do from investing my talent, my time, and in helping to something greater. I'm looking at how I can volunteer. I'm looking at how I can do more exploration of what I want to do with my life from a career standpoint. I mean, how many students do we work with that say they don't know what they want to do? And how many times do we sit there and work with them and try to figure it out, or help them do some career assessments, help them look at their strengths, their strengths inventory. I mean, different things of that sort. Using this as an opportunity to take some time to look at that. Looking at paid work, looking at radical thinking, and just really thinking through, what I want to do. Not what my parents want me to do, but what do I want to do, right? So these really, if you look at this gap year model, it's so incredible of what some of these gap year programs are doing. Can we go to the next slide, please? So take what I just said about thinking about a gap year and thinking about how important a gap year could be in this pandemic, in this environment, taking some time, maybe not just jumping on a college campus. And then we looked at, how best practices should treat those with anxiety, depression. And we looked at this wellness wheel. For those of you who don't know, the Depression and Bipolar Support Alliance have the wellness wheel that really talks about looking at how are we helping our clients, or how are we helping look at where we're at physically, how are we doing for exercise, where are we at occupationally, how are we helping from a career exploration standpoint, pardon me, how are we doing budgeting, where are we living, are we living in a safe environment, are we living in a healthy environment, how are we doing with a social connection, do we have social friends, what does our social community look like? Intellectually, how are we challenging ourselves intellectually? What are we learning spiritually? What are we doing on that front? And it uses this wellness wheel to really assess how we are doing individually from a wellness standpoint. And so we took a look at this wellness wheel. We took a look at this gap year model. If we can go to the next slide, please. And we said to ourselves, we have an opportunity to help more people. How are we going to do it? And we looked at what we were currently doing with our Sober Dorm program at Caron Renaissance. For those of you who don't know, we have a cohort of 10 individuals that are in a level of care, usually in either intensive outpatient or an outpatient level of care. They're going to school remotely right now. They're engaged in a social community through connecting with our other staff, other patients on campus. We have on-campus activities. They're engaging in clinical services where they're going to IOP. They're engaging in groups. They're engaging in a lot of different things, and they're doing fairly well. And can we look at how we can take our Sober Dorm program, which is traditionally for students in recovery or those who are struggling through substance use, and really offer that to all students who are looking for that emotional wellness, who are looking for the ability to have structure and accountability, who need personal growth and life skills, who are dealing situationally with anxiety, isolation. So really what we've created at the Caron is this Caron's program, Caron Semester of Support, which is taking what we're existing doing and really opening it up to more people who could benefit from that. And to really look at how we can minimize the fear of parents, to know that they can be in a bubble, in the college bubble on our college campus, and be able to know that their student is engaged in school, engaged working with career services, working with educational services, working with my team, working with a clinical team, having access to our medical team, all in a bubble, so that we're able to provide a safe environment and to foster a cohort of like-minded individuals working together to contribute to this world, as Dr. Galway had referred to in some of his lectures. Use the next slide, please. So really, what we're trying to do here at Caron, these are the references that we looked at, is looking at what colleges have done so well, actually, is creating, if you think about a living learning community, an LLC, the idea of an LLC, a living learning community, is for for those who don't know what an LLC is, you should definitely look it up, is that universities years ago saw that it was, and I was in one actually, where, now I'll share my experience at Colorado. I signed up for the Living Learning Community for Business, meaning that I was at University of Colorado Boulder undergraduate. I went there. I had all my classes together with this same cohort of 20 students. So these 20 students, we had all of our big lectures together. We lived in the same dormitory environment. We were able to build that and foster that like-minded support. Collegiate recovery was built on a very similar model. So what we're trying to do is taking that model and looking at building a cohort here at Caron, where we're able to have them in a college bubble where they're doing classes, they're engaged in some clinical support so they can get the help they need, right, to get through this time. That I think anyone would benefit from addressing the anxiety, the depression, and other things that I think a lot of us are dealing with, and to really provide a safe and effective way to ensure that there's zero transmission, and to ensure that if there is an issue, that we can deal with that effectively. So we have created this gap year program to ensure that students are able to do school, they can work, they can do all these things during the day, and also have access to academic check-ins with my team, and also work with our clinical team to address the underlying clinical stuff. So we're very excited about this. And if you want to learn more about it, please reach out to some of my colleagues. But again, what I want to encourage, and my call to action, if I may, before we get into the questions, not just look at this Caron semester of support, but really as clinicians, as families, if you're thinking about, I don't think my son or daughter should live with me for this college semester, they should be somewhere else. Look at what other places are offering for structure, accountability, and support, but also are helping foster that growth, that emotional growth that we really need for these students to be able to deal in this uncharted territory. So I just want to thank you all. These are some references. I really encourage you to look at dbsalliance.org. I love this wellness wheel. I think it's really incredible. The Wall Street Journal had some pretty fascinating articles, again, about reopening. Again, and things can change in a week. So, thank you so much for having me. Harry?
Jonathan, thank you so much. That was excellent. So now we will move on to answer some of the questions that were submitted during the registration process. And to start it off, Jonathan, how can college students talk to their parents about setting boundaries and expectations, especially if the student had been living in the dorms or on their own pre-COVID-19 and now has to live back home with their parents?
It's a great question. It's a great question, right? So the whole idea of I'm an adult now, you don't need to monitor how I'm doing. I love acting as the child, because I was kind of that student. I think that boundaries are very important. I think that if you're a parent, you're having your adult child live at home, I also think that it's realistic to have a discussion around, what expectations you have of them allocating their schedule, what expectations you have of them getting the most out of school. And so this is the good news. The good news is that with most remote online learning platforms, it's really much easier to see how engaged the student is. And I could be completely wrong about this, but this is from my experience, is that you're able to see if the student's has logged in. You're able to sometimes see in some of these platforms, see how long they've been logged in. You're able to see if they've submitted their online assignments. You're able to see a lot of things of how they're doing. And I'm not saying that you should be, as a parent, checking that or researching that, but I think that it's important to know that there's something called a FERPA, which a lot of parents are aware of, which allows you to have access to their educational records as a parent, or allows you to have some check-ins so that the school will be able to release certain information. I encourage that every parent has that conversation before August so-and-so date starts, that just as they would be a traditional student, you would want the FERPA signed and say, listen, we expect that you're going to be signing this FERPA. We're paying for school, or we're contributing to school, or you're living under our roof, and this is the FERPA document. We're asking that you sign it because we want to know how you're doing. Now, that's fair, I believe. The challenge is in what respect, right? Checking their, to be an academic monitor of their performance every day to see if they're showing up to class, or if they've logged in, or if they've sent their emails. That's a lot. And quite frankly, that's not very healthy. That's what we're seeing with a lot of our families who are kind of enmeshed. It's a real challenge, right? And it's really, 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 really hard. I get it. It's counterintuitive. You've been raising your kids and your job is to look after them and protect them. And then all of a sudden they're 18 years old and you're just supposed to kind of back off. And we're not saying that. What I am saying is that if you're a parent of a young adult who's going to school, living with you, who has some depression or some mental health issues that they're working through, or situationally have experienced a lot of isolation and other things, I really would encourage you to talk to your local therapist and talk to those individuals who are working with you to speak about how to create some boundaries and expectations around this. It's very individualized, right? And I don't think I can say, hey, you should be checking once every week, or does your son or daughter send you an email update of what they got done? I think it's important to understand that I do believe that there should be some level of accountability and transparency, but I think how that looks really needs to be spoken with a professional about, especially if there's some underlying clinical issues.
Great, thank you. And how will virtual learning impact students' mental health, as socialization will be greatly hindered?
So I think it's a great question too. I think that, the good news is that social media, our teens and young adults are so used to social media to connect, right? In a lot of ways, there's a lot of different theories and a lot of different data out there that says that virtual learning can be even better than actually include classroom learning. There's studies that say that doing virtual learning and then hybrid actually can be detrimental, because it's disruptive having it just online and then you go to a class once a week. It's better, the students are better served just having it physically online. And there's a lot of studies that say it should be just all physical classrooms, and being in a physical brick and mortar is best practice. And I think that, virtual learning can be an incredible opportunity to be able to, based on your willingness as a student, to get the most out of it. What do I mean by that? Is that, are you willing to go to your professor's office hours and drop by your professor's office hours and remotely and ask questions and be engaged? I mean, a lot of the students I'm talking to is saying, like, how do we engage our professors or our TAs? Well, you do the same thing you were doing before, or even more, right? And make an effort to get the most out of the learning experience. I think that with technology, you're able to have these connections. So I would say it's what you do with it. I would say my concern, and I'm going to say it again, is that the University of Texas example is, what's the difference between being online at home and then going to a college campus and being online in your bedroom and not having that structure and accountability? I mean, I don't think there's a lot of difference. What's important though, what makes that difference is accountability, support, be able to connect with other social people in a social distancing platform. I think a lot of colleges are creating study lounges, which I'm really excited about, like virtual study lounges. I mean, there's a lot of things that colleges are doing to create that connection, but I think there's going to be a lot of need for peer accountability as well. So thank you for that question.
Perfect. And just to piggyback off that and go a little bit further, how can we help students connect with their peers when their classes are being conducted virtually?
I mean, it's a threefold question. One is, how do we help them connect with their peers on a healthy, and what are healthy forms of connection in this environment, right? So talking about what is proper social distancing, what can be done effectively with minimizing exposure, what's allowed by the college for them to be socially connected. I mean, I think it's a challenge, right? I think that it's really, a lot of these colleges, a part of orientation is going to be discussing and kind of what their expectations are, what the safety pledges talk about. But I think the great news is that this generation is so used to technology to connect, right? So that's a great news. The not so great news is that I think that there is this pent up demand of wanting to connect and get out there, and I think the consequences could be pretty substantial. So I think that if you look at the most effective treatment modalities, have some peer-to-peer mentoring, peer-to-peer support, that social connection, which is so important. And I think it's going to be so important for the young adult or the individual going to school to be connected with other like-minded individuals that are having similar goals, which is prioritizing their health, prioritizing the health of their family members. I mean, and really reevaluating what's important. I think this is a time for all of us to reevaluate what's important. So, I'm going to say it. I'm really, really, really scared about this fall. And this is one of the reasons I'm so passionate about this program. And I'm saying this from my heart because, an 18-year-old going to school, violating the policy, God forbid, contracts COVID-19, goes to that one classroom, the professor is teaching them, gets COVID-19, God forbid, something happens to that professor. I mean, these are lifelong consequences that someone has to live with, God forbid. How are we treating these young adults? How are we going to help them understand this on the preventive side of it? But God forbid this happens, I would imagine that there's going to be a lot, and I don't want to think this, a lot of individuals that are going to be violating the safety pledge and, are going to have consequences both judicially, right? But also have real physical consequences. We're going to see what they've done, and the trauma around that, and the other side of it. How are we as clinicians, how are we as professionals prepared for this call to action, So I'm scared, I'm nervous, but I'm also, I think that we have a duty at Caron, as well as if you're a university colleague, if you're a private practice clinician, if you're a therapist, if you're a parent, we have obligations to really let the universities know, and I want to start doing this more and more, is let them know, if someone violates a safety pledge, if something happens, right, let's get them the help they need, right? Let's not just dismiss them and say goodbye. That's my opinion. Let's get them the help. I mean, obviously, each individual case has to be looked at, right? A university needs to look at each case, but have a protocol set up where, and I'm sure most universities are doing, what's the mental health component going to be addressed? What's the outcome? All of a sudden, they're not on the college campus, they're back home isolated. How is that going to help? So my suggestion is to have leverage. I think leverage saves lives. And what I mean by that is if you violate the safety pledge and something happens, really have something in place to put them, to say, either you get the help you need, or you do this, or you're not allowed back. But try to have some precautions in there so you can help these individuals that may be making poor choices and underlying issues behind that. So thank you.
Thank you. Another question that we received during registration is, how will mental health be supported in school systems that will be overtaxed with providing COVID-19 safety requirements?
So, I think that every university is issuing a statement. They should be issuing, every university I've been following has a release around what they're doing for their return to school campus. If they're returning to school, what that looks like, what services are being offered, what support services are being offered. I think the good news is that with telemedicine, that there's more scalability, meaning that the counseling center could have a more profound impact and be able to connect with more students. I also think as parents, or if you're a parent, I think to be proactive and to reach out to the Dean of Students office and to the counseling centers to see what off-campus resources they have. Most universities have a referral list, which are local private practice clinicians that are specialized in treating college students. So I would encourage you as a parent to get that, to know what I think it's important that the university is able to provide those services, but also as a parent to know what services are off campus in your community. I also think if you're a private practice clinician and you're interested more into helping this student population, to reach out to your local universities to see how you can get on the referral list so you can be able to support these populations during this very difficult time. But I think that this, this is definitely a different a different time that requires more touch points than ever before.
Perfect. And what are some of the biggest concerns you're hearing with the transition back to school or college this fall? And what solutions have you been offering in response?
So the biggest problems is the, no one really knows what's going to happen. I think the biggest concerns is the safety pledge. Someone violates it. What's that look like? And to get clarity on that, I think that these universities have very specific policies around that, so you can see it. But I think that the biggest fears I hear from parents is they don't know if their child really truly grasps how important this is. And I think that some of the other issues that you're facing is that, I think it's really, really hard to say you're a hybrid program, right? And the college is open up, it's hybrid, and you have 5 classes, one of which you have the option to go on in person. I mean, without that mandate and without that structure and accountability, I think that some of the biggest challenges we're going to see is a lot more isolation. And I think we're going to see isolation on a college campus, and then on the other extreme, acting out, right? Whether that's through increased partying, increased use, increased other things on a college campus. So I think that the biggest concerns I'm seeing is this. I use this word pent-up demand, and I don't know if it's the right word, but this pent-up anticipation for college. And so that's some of the biggest concerns. The other concerns I have is a lot for these professors, going back to be on a college campus, and the concerns on that side that we haven't been talking about, that they're putting their lives at risk, and how to protect them. I just think that there's a lot of fear and anxiety of the unknown. And I also think that with social distancing and best practices, this can be minimized, right? It just, how to get that implemented within a college bubble, So I call it the college bubble. That's what we're trying to do out here, is we've created a bubble down here at Caron Renaissance that's extremely effective, based on what Harry has said, and our extreme effectiveness of that. And we're going to try to extrapolate that out for this population of college students that are in need of structure, accountability, support, and maybe having an underlying clinical, maybe in need of underlying clinical support.
Thank you. And pivoting back to the educational side a little bit, what are the keys to success for virtual learning, and what are, if any, advantages over traditional in-person schooling, other than just not being exposed to the virus?
Yeah, I think that virtual learning there's opportunities like getting the lecture slides ahead of class, being able to go back to the class to see the class. If you've missed anything, I think that there's opportunity to be able to sometimes have it at your own flexible schedule. So it's particularly around people that are working or more professionals, that's a great opportunity. I think that also the opportunity to be able to reach more people. I think that that's a huge advantage of virtual classes. I think that one of the things about virtual classes that can be really, really empowering is the ability to self-advocate, which is, you're not being called on in a classroom, you're actually raising your hand, hitting that raise your hand button, or being able to follow up with the professors and advocate. And I think that professors are going to receive that even better. I think some of the challenges with the virtual classes are that challenges and opportunities is that professors can actually, let's talk about something actually interesting, is that professors can see everyone who logs in, right? So now we can know for sure if students are showing up for class, right? So as a parent, the good news is you get to see if your child's actually getting the most out of your investment in college, right? Are they showing up for class? Now, granted, they stay there for 20 minutes, they leave the class, but really professors can see in some extent how engaged a student is, right? So I think that there are some real opportunities here to use for data points to see how our students are doing. I would recommend a few different things of just to think about for our educators that I'm seeing that's working for our student population is sometimes getting our students to buy the textbook, even though it's an online class, buying the textbook and having the physical textbook and writing it down and going through it and having the slides printed out, not just focusing on but actually having the pen and paper is so helpful. It helps with processing, helps with repetition. So although it's virtual, trying to have some engagement activities. I think another thing of opportunities and challenges for students with learning issues, processing difficulties, how do we support them with the appropriate accommodations? I think we have to be out ahead of it and making sure that we're reaching out to the student service centers to see what's available. So really it allows us to be very proactive. But again, the more you can be structured and have structured time allocated to studying. I really love this rule of thumb that for every 1 college credit hour, you should be allocating 3 hours outside of the classroom for studying time. And I think that's, so for a 3-credit course, you should be studying for 9 hours outside of that time. I mean, I think that the ratio has been very effective for me in my work, and I like using that with my students. So really allocating that structured study time.
That's really helpful. Thank you. So now to move into a couple of questions that have come through in the Q&A chat. So first, does Caron Semester of Support program work with any particular colleges, or do you work with the student's existing college of choice?
So we work with their existing college. So the great news is for years, I'm sorry, I had to use my hands like it, for years, one of my biggest passions was working, what I wanted parents and families and students to know is that, to tell a student that they can't ever go back to their original college because they're in recovery is just, you don't do that, right? I mean, yeah. So we always tried, sometimes going back to the original college when someone's dealing with a mental health issue or dealing with other issues such as substance use or underlying trauma, whatever that may be, buying more time saves lives. What I mean by that is, I always wanted universities, like if someone at Penn State, maybe not going back to Penn State the next semester, maybe taking some time off from Penn State. So can they take their major classes online through Penn State Virtual? But what about colleges like Franklin Marshall and other colleges historically? Now Franklin Marshall does have online classes, but historically there's been a lot of colleges that don't have online classes. So really advocating to these colleges to allow the student to have some time off campus to really build their emotional maturity up, to help them deal with their underlying clinical issues so they can be armed with the facts to be able to be on a college campus and stay sober or to make healthy choices. So the great news now is that we're able to do that more than ever because colleges have tons of virtual platforms now because of COVID-19, and that most colleges allow you to if you're not going to be there physically, you can take it remotely. So I think that the key piece with that being said, University of Pennsylvania, my alma mater, they're going to be most of it's going to be, it's going to be able to take online classes and be able to access that. So you're going to be able to access some of the best universities in the country without necessarily physically being at the university. What better opportunity is it to say, hey, maybe I could do some work on myself clinically. I'm struggling with this, or I'm struggling with that, and I can use some structure and accountability and take some time off. And if it's not here, Caron's Semester of Support, where else are we offering this opportunity for experiential learning? So yes, and still working with the school that they're from. Absolutely. Boost your GPA. You're still building your academic portfolio. But I think we'll have to ask, what are we doing with this time to contribute to this world?
That's great. Thank you. Another question that we just had come through, with the lack of accountability of having to go to physical classes and students having a lot more downtime in the dorms, do you anticipate drug and alcohol use will increase? And what are some red flags that parents should be watching out for?
So it's a great question. So I would like to ask and encourage all parents on this call to really, and this is really tough because it's like, you can tell your young adult all these things and they may not listen, right? So there's a few things. One is that you should have the conversation around the FERPA, right? And that allows you to access their records. Now, it's online now, and maybe you can log on to their site. You don't want to do anything that you want to. We are, as parents, we want to be parents. We want to be people of integrity. We want to mirror. It's easier said than done, right? Mirror good attributes. And I had a parent saying, I'm just logging on every day to see if they're logged in. I'm like, no, that's not. And all that does is irritate the student. Get the FERPA signed. Get that document signed. Set up a time each week to go through to see how they're doing. Let them pull up give them the option to be able to Zoom with you and pull up to show you how they're doing or how they're engaging in their classes, right? Figure out something that works, but don't be checking every day. I think it's really hard, but I do think, and I really want to say this more than ever, and my academic colleagues, we go back and forth about this idea that they're adults and they should be treated as adults. And, that as adults, you don't see if they're showing up on class. They have to be responsible for their own consequences. And I understand that. But these are at-risk adults now, especially given the fact that, you know, the pandemic, the isolation, especially those who have had pre-existing conditions. You know, I think that a family should have some access and some know ahead of time of whether their students showing up for class, engaging in class, and how they're doing, because I think it'd be early signs for something greater. So Mike, so figure out what that works, but whatever you do, get the FERPA signed, go through that proper process so that it's a communication with your son or daughter, and it's being done in a way that's up and up.
Thank you.
But the great point is you have the data points. Are they showing up for class? Are they going to class, right? You'll be getting that information if you choose to do it in a way that's effective. So.
Great. Well, unfortunately, it looks like we're just about at the hour. Jonathan, thank you so much. That was a really, fantastic presentation. And I just want to remind everyone to join us next Tuesday, August 18th, for a continuation of our webinar series on the topic Understanding and Treating the High-Functioning Addict or Alcoholic, featuring Executive Director of Caron's Grandview Program, Samantha Smith, and a guest speaker, Dr. Caron from Air Counseling. Watch for your email for details on how to register. And as a reminder, please reach out to your local regional resource director at any time for additional information, resources in your area, or questions regarding admissions to any of Caron's programs. Our residential campuses in both Pennsylvania and Florida are open and ready to provide world-class care for those suffering with substance use disorder and mental health issues. We've had zero community spread of COVID-19 at any of our sites. Additionally, many services at our regional recovery centers have gone remote, but we continue to provide outpatient, intensive outpatient, and evaluations via telehealth. We look forward to seeing you in person soon. Please visit caron.org or contact your local regional resource director for the latest on our response and preparedness to ensure patients remain safe and healthy while receiving the utmost quality of care. Thank you again, Jonathan, and thanks everyone for joining us, and have a great afternoon.
Thank you, Harry. Thank you, everyone.